Okay, I'm going to run through the setup now for a therapy or training session. This would be a dynamic reading at near type of session. Again, the eyes, I'm going to want to work with both eyes, so I'm not changing that. With the diopters, based on what we found before, I wanted to decrease the base in to not have any diplopia. I thought that would allow the dynamic reading act to continue as the base in demand was being changed and not have to go through that double period. I also reduced the base out a little bit, so the total of 20 prism diopters. Again, note that this is number of diopters per eye, so the base in is set at 7. That would be for a total of 14 base in. The base out is set for 10 prism diopters. In the run that we just did, that turned out to be a little bit more than she could handle on the second time. So I think what I'm going to do is I'm going to reduce that to just 8 diopters this time. 8 per eye, or 16 base out. So this will go 16 base out, ramp into the base outside first, and then go into a total of 14 base in. She actually handled that well. I'm not sure we're ready to increase the base in by a prism diopter, but the basic idea of working a training session here would be to do 2 to 5 repetitions, see what the patient can handle. If they're handling those edges well, increase them slightly. I would probably just do like we just did, a 1 or 2 cycle run on a first time increase to see if the patient could handle it before we would do more actual ramp ups and that type of thing. So I'm going to decrease the prism this time. And she reported that the speed was pretty good. I went down to about half of what I would normally do in our testing scenario. So I think I'm going to leave this at a half prism diopter per eye per second, which is a total of 1 prism diopter for both eyes together. And we'll just do 2 cycles again this time.